Greetings. Let us talk about Hemospray. These are my acknowledgements, and today's learning objectives are the following. We will learn about the uses of Hemospray and also how to set up and handle this device. When you encounter bleeding that is difficult to control with traditional techniques, either with the use of a bipolar probe or epinephrine injection or with a clip, and you're stuck, in that case, you could use a special hemostatic powder that you could just spray over the vessel and achieve hemostasis. And once you achieve this, usually the effect lasts for a couple of days and the bleed is likely to restart, and you should consider definitive therapy. So it is basically used as a salvage technique when traditional techniques of hemostasis are not able to control the bleeding. When it comes to setting it up, you need a large bore syringe filled with air to flush the catheter as it's being delivered down the endoscopy channel to keep the catheter dry. It has to be dry, otherwise the powder will clog the catheter. So it's very important to do this maneuver, and that is keep on flushing that catheter. This is the through the scope catheter, and keep it dry, and then you have the Hemospray device that actually is powered by a carbon dioxide cylinder that delivers a special powder that tends to form a coagulum and clot off the blood vessels. So let us go through this thing one more time. Here is a Hemospray catheter. Unlike other catheters, this catheter is a little bit softer and it can get kinked. So one has to take a lot of precaution as the catheter is being pushed down the endoscope channel. So the endoscopist has to make those small gentle moves as the catheter is going down. We already talked about it. As you can see here, the nurse or the technician is continually flushing the catheter with an air-filled syringe to keep the catheter from getting moist from this fluid collection in the scope channel. So keep it dry, and the endoscopist should refrain from suctioning on the fluid to prevent the catheter from getting it wet. So keeping it dry is a very important thing. And once the catheter has gone down, you hook the catheter to the device and tightly, and then you activate the carbon dioxide cylinder by turning the red knob in a clockwise direction till it stops. Then you open that red valve by turning it in the direction of the catheter, and once it's there and the endoscopist suggests that you start, you press on that red button, that's a trigger button, for 1 to 2 seconds. That will give you a pulse of CO2 and drives the powder, the Hemospray powder, down the catheter channel onto the lesion. So let us see how this works out. So we got everything ready, and here is a large lesion that's bled. We were not able to find the bleeding source. It was a massive bleed, and we decided to treat this patient with a hemospray. As you can see, we applied one puff, and then we're going to apply some more puffs to control that area. So one important thing as this is happening, the endoscopist should refrain from suctioning. It's not uncommon for the catheter to get clogged. If it happens, usually the device comes with an additional catheter, and you could repeat the procedure by gently pushing it down without allowing it to kink, and keeping it dry by continuously flushing with a syringe, and then hook it up to the device and then activate by pressing on the trigger button. I hope this is useful. Thanks again.